legalizefreedom.com. Why are we here? Where do we come from? Where are we going? From the nature of reality to the future of humanity. Listen without limits. Unchain your brain. Change your thinking. Change your life. legalizefreedom.com.
Greetings and welcome once again to legalizefreedom.com. I'm your host Greg Moffat, and my guest today is Sebastian Rushworth, who joins us to discuss his book, COVID, Why Most of What You Know is Wrong, which examines some of the most central questions about the COVID-19 pandemic. How deadly is COVID-19? What is long COVID? How accurate are the COVID tests? Does lockdown prevent COVID deaths? What are the harms of lockdown? Do face masks stop COVID? Are the COVID vaccines safe and effective? Why did the world react so hysterically to COVID? Rushworth demonstrates that COVID-19 is nowhere near as bad as it is portrayed by the mainstream media. He shows that the mortality rate is below 0.2%, meaning that for most people the risk of dying if infected is less than 1 in 500 and less than 1 in 3,000 if you're below 70. The disease preferentially strikes people who are anyway very close to the end of life, so the amount of lifetime lost when someone dies of the disease is usually tiny. He also shows that 98% of people who get COVID are fully recovered within 3 months, and that there is no good evidence that COVID results in long-term health consequences. Moreover, he points out that the measures taken to fight COVID, such as lockdowns, huge fear campaigns and school closures, will result in far more years of life lost than will be directly lost to the virus. The data used in the book is publicly available and frequently published in some of the most prestigious and respected scientific journals in the world. Hello and welcome, Sebastian, and thank you so much for joining us today on legalizefreedom.com.
Thank you. It's my pleasure to be here.
Sebastian, today we're going to be talking about the COVID pandemic and the global response to that, a lot of which is encapsulated in your book entitled COVID, Why Most of What You Know is Wrong. Before we jump into that, just for listeners who don't know, give them a brief potted bio of your background and your work in general.
I work as a physician in Stockholm in Sweden, and about a little over a year ago I decided to start blogging and just I've been thinking for the last couple of years that I'd like to counter some of the misinformation that spreads on the internet in relation to various health and medical issues, and so I wasn't really I actually wasn't thinking of writing about COVID at all, but I had this conversation with my mother after I'd been just a couple of weeks after I started writing and working on the blog, and I mean I work as a doctor, so I'd been seeing COVID patients in the hospital, and I'd kind of been following what the studies were showing and what the statistics were showing, and my mother was coming at it from a very different perspective. She doesn't have any kind of medical background, and her perspective on the pandemic was basically what she was getting from the news. And I just noticed that we had this completely different understanding of what was going on, and I thought that would be interesting to write about. So I wrote a little article about that, like in I think in August of last year, and the article went hugely viral. I think like 500,000 people read it within a few days, and so I realized that there was a lot of interest in getting a a different perspective on the pandemic. So I wrote a few more articles, and then a publisher contacted me and asked me to write a book. So I did that, and so that's kind of what resulted in me writing so much about COVID. It was never a kind of a conscious plan to begin with.
No, and it should be emphasized that your blog is simply a medical and health blog. It's not a pandemic blog by any means. There's plenty of those out there. It's just that it would be rather strange if a practicing doctor who had a medical and health blog was not mentioning COVID in the midst of all this. It's the big health issue of the day. But you also mentioned at the start of your book that you had this rather strange experience during your medical training with regard to diet and nutrition and what you were being told. And that informed you, and I think this is why you mention it in the book, and that informed your attitude to the COVID question, which was, there was a sort of a consensus version of things and how things should be dealt with, and, how to treat people, and just all of the usual considerations that any medical doctor or medical professional will take into account. But you were saying, oh, hang on a minute, that doesn't seem right. And a lot of it did, with regard to COVID, a lot of it stemmed from your experience, being taught about nutrition and health.
Yeah. So I developed an interest in nutrition a couple of years before I started studying medicine. I didn't start studying medicine immediately after high school. I actually studied business and economics, and then I worked doing that for a couple of years. And then, so I was 30 when I started studying medicine, and already had kind of a lot of other experiences. And and like I said, I'd had this interest in nutrition for a couple of years, and I'd been looking into the research long before I started studying medicine, and I mean, doctors learn very little nutrition in medical school. I think over in Sweden, medical school is 5.5 years, and I think we have maybe one day of lectures on nutrition during that whole time, and it just became clear to me that what we're taught in medical school when it comes to nutrition is largely incorrect, and it's kind of it's very dogmatic. It's I mean, what you hear from public health authorities is it's kind of this dogma that was developed in the late 70s and early 80s, and that is completely resistant to any kind of change. And in my last term of medical school, we had a lecture with a nutritionist who came from the Swedish public health agency, and she literally said, she showed us a list of 10 bullet points, and she said, this is your Bible, this is what you're going to tell patients. And I just kind of scanned through it, and I saw that most of the things on that list were actually not supported by any kind of scientific evidence. A lot of them have been disproven, and yet that's still kind of what we're being told is the truth, and that we're supposed to promulgate. And I think that this experience kind of caused me to just become more skeptical in general, and feel a strong need to look into the evidence, not just on nutrition, but on everything. And so this is what caused me to decide that I wanted to start blogging, because it would give me kind of an excuse to do deep dives in different issues and see what the science actually says, and then discuss it with other people on the internet who are interested. So I guess that's kind of what shaped my thinking, and what also caused me to question and a lot of the COVID narrative, and especially when I looked at the studies and looked at the statistics and saw that what they were showing was really very different from the picture that was being presented in the media.
Well, the whole thing about nutrition is very strange, because you would think that, even considering that, there isn't one diet that fits everybody. There are some general things that we can say, but if you go to a professional nutritionist, one of the things they're doing is trying to look at someone's special health needs or challenges or requirements, or what they're trying to achieve, what's working, what isn't, and tweaking that. The idea that this food pyramid, which I'm even familiar with from school, it's supposed everyone in the world is supposed to eat that and thrive, is, obvious nonsense, not possible. When did you first begin to question? There you are working on the front line. Do you remember the moments when maybe it was one moment, or maybe it was a creeping sensation of like, why is what I'm seeing, what I'm experiencing, not matching up with what's being presented to most people, lay people, members of the public?
Well, so I mean, there were a number of things that happened in early 2020 that were a little bit funny, and one of them was when the whole COVID hysteria began. When COVID first came to Sweden, all the patients disappeared. No one was showing up at the hospital anymore, it wasn't just a temporary thing. It lasted for months. During this whole massive first wave of COVID, the number of people presenting at the emergency room was like a fraction of what it normally is, and the Swedish authorities, they built field hospitals to handle this expected onslaught, and these field hospitals never ended up treating a single patient, and I kind of went, well, so this is a bit funny, because what's being presented in the media is like that the healthcare system is overrun, and that's really not my personal experience working in the emergency department, and it's not even what you'll find if you actually look into like what is the current number of people being treated for COVID in the healthcare system, and I mean, there were COVID patients coming to the hospital. I mean, it's like all the patients vanished, but the people who came were COVID patients. But it was never an onslaught, and the patients, I mean, they weren't that sick, most of them, or there were a few that were sick, but the vast majority we could send home. So sent home from the emergency department. So this whole picture of a deadly pandemic just didn't jive very well with what I was personally seeing. And so I guess that kind of disconnect was what got me thinking to begin with.
Well, perhaps we could say a word about studies and statistics, because of course both of those have been shoved down our throats from the media, about saying this study confirms the following, and this terrifying study confirms the next thing, and these statistics show this, and these statistics show that. But what I find, I actually stopped paying attention to the mainstream media on March the 17th, 2020, because I could tell what was coming, and I knew it was going to drive me nuts. But I've found since then that any big events relating to all this, anything that I need to know about, the information finds its way to me. So I've been able to switch off from the media and still know what's going on, which is interesting in itself. There's this lack of context, and first of all, some of these studies are just, you have to look at how the study was designed and how statistics are presented. Again, what is the context of it? And one of the things that irritates me, particularly with the mainstream media presentation of numbers, terrifying sounding numbers, to the public, is that they're not very good with percentages or comparisons. For example, they'll give you a number of cases, but they don't say, yeah, but that's however many thousand cases, but that number, what percentage is that of a total of any given population of a town or a country or whatever? And they don't do comparisons like X number of COVID deaths. There's a whole deaths with COVID and death from COVID. But yeah, how does that compare to other causes of death? They never put that in context. They won't say, okay, so we had this number of COVID deaths during this month, but actually that's much slower than heart disease or cancer. And that's not trying to remove the fact that it's a problem, but context would really help people get this in perspective.
Absolutely. I mean, a lone number is meaningless. It really tells you nothing. The only way to understand numbers is in relation to other numbers. And if you say hundreds of people died of COVID today, that sounds awful. But if you say normally we would expect 10,000 people to die in a day, and the number changed from 10,000 to 10,200, then suddenly it doesn't sound as bad. And that kind of context has been missing the whole time. It's the same with when you look at hospital admissions, and they're saying the hospitals are crashing because they're so full of COVID patients, but there's no comparison made with previous years. And I mean, if you look at media articles, hospitals were crashing in every winter of the last 5 or 10 winters. That's what they do, because we have and it has nothing to do with COVID. It has to do with having a stretched healthcare system that doesn't have the excess capacity necessary to be able to handle peaks like you see every winter when you have lots of people coming in with influenza and other respiratory viruses. And it's this kind of this complete lack of putting things in context, which I think can only be understood from the perspective of wanting to scare people or wanting to make things sound as bad as possible, because it sells more issues, because you get more clicks and more views and or whatever. But this has been a constant issue throughout the pandemic, that numbers are never presented in any context, and so people don't have any context, and most people think this is a deadly pandemic. They think their personal risk of serious disease and death is huge, even if they're young and healthy, and their actual risk is maybe 1 in 20 or 30,000. There's this kind of huge disconnect between reality and what people believe.
Yes, here in the UK, the NHS in crisis, close to collapse, has been a clarion call for as long as I can remember, usually in the winter. And I remember previous headlines with avian flu and swine flu and whatever else sorts of flu. And, it was going to be sweep the world, and it would be like, post-apocalyptic, and it never happened. And it seemed to me this time round, it was just that a lot of the ways that things had been done previously were kind of reversed. So you just got a completely different impression. If you weren't close to it, if you weren't really paying attention, if you weren't doing your own due diligence on it, you could get a completely different impression because it was presented differently. In terms of numbers of deaths, I remember when 9/11 happened and you had the 3,000 plus people tragically died on that day of those attacks, but how quickly the number of innocent people killed in Iraq reached 100,000 after that, all in the name of 9/11. But again, those two figures were rarely presented together, just as for a question of perspective. Is the response to 9/11 proportionate? And especially in terms of like what outcome are we looking for? That's of course another complete discussion. But yeah, as you say, lone numbers are basically meaningless. And another thing is questions of differences within science on any given topic. And you'll be well aware of, there's a spectrum of views, sometimes quite narrow. Most people generally agree on something, and on some subjects, scientific or medical opinion can vary very greatly. And during the pandemic response, the clarion call has been to follow the science. This is a science-led response. Anthony Fauci and others in the US just saying, it is unscientific to question this. But the question is, whose science? Because science and medicine, for that matter, is carried out by human beings, individuals. And we know that from the point of view of medicine, there's all sorts of different ways of treating illness and injury over thousands of years, that some of which turned out to be complete quackery. And that, why were we doing that? Well, at the time we thought it would work, a course of leeches and bloodletting and that sort of stuff. And other stuff has persisted and been built upon because it's proven, its efficacy has been proven. So when the media are talking about follow the science, what annoys me is how people like yourself, who are coming along perfectly level-headed, perfectly qualified to comment, have been marginalised, and an impression is given that 99.99% of doctors and other medical professionals and scientists working in the medical field are all agreed on this view that's been presented, and that's simply not the case.
Yeah, it's pretty funny, and it's like science is handed down as kind of these tablets from above, and that's not how science works, and it's not what science is. The whole point of science is debate and difference of opinion, and especially with this new virus and this completely new way of handling a pandemic, we're dealing with a huge amount of uncertainty. There's a huge lack of data and information, and to be saying that the science is settled on any of the important issues in relation to COVID, which the authorities have been saying since day one, is just patently absurd. I've been kind of shocked at the narrowness of opinions that are allowed to be presented in the media. It's like it's kind of like I guess when a country goes to war and the media stops its normal role of kind of criticizing and holding government and power to account, and just kind of starts marching in line behind the government and saying whatever the government decides is the truth. And the kind of behavior you would see from media during I guess like the First or Second World War, that's what we've seen during COVID, and it just happened so quickly that the government stopped, that the media stopped thinking independently and just started marching in line behind the government. And I get it's kind of frightening, because in reality there's this whole breadth of opinions and views on how to handle the pandemic, and a lot of the alternate views are perfectly reasonable and have a lot of basis in science. And like with lockdowns, for example, this is something completely new that was invented in 2020. Prior to 2020, there was a widespread agreement on how to handle pandemics that was completely different. And suddenly people who are saying, well, we should kind of be handling this pandemic the way the WHO said before 2020 that we should be handling pandemics, that viewpoint is presented as like ludicrous and insane when it was considered the most reasonable course of action as recently as 2019. And so there's been this kind of narrowing of acceptable viewpoints from the beginning of the pandemic that I find very hard to understand.
Well, I did hear anecdotal evidence that the WHO, World Health Organization, had changed their definition of what a pandemic is in order to declare this a pandemic, but I have not verified that. Let's talk a little bit about COVID tests then and what constitutes a case. This is another area of frustration for those of us trying to get clarity on this and trying to ensure that the general public are able to understand what's being put before them. There's a whole question of the efficacy of the tests, and we probably can't really get into cycles and PCR tests and what have you, because that gets a bit technical and can take a while. We would have to basically explain it. But there's a question of how effective the tests are, what sort of results they're throwing up, depending on how they are, well, basically just how they're set up, what are they looking for and what the thresholds are. Maybe that's a good word, what the thresholds are. And then what constitutes a case. And of course, anybody who tests positive is now being called a case, but I'm not sure, certainly in the UK and probably lots of other parts of the world, that first of all, during flu season in previous years, people weren't being tested, but we could be going around with flu virus antibodies within us, millions of us, maybe billions around the world, but we're not being tested, so we're not being counted as cases, and that's what constitutes a case. And if somebody's asymptomatic, yes, they may be able to pass that disease on, that infection on, but that changing the definition of case in that way seems to me very disingenuous and not helpful at all, because it doesn't really tell us how many sickened people we're dealing with, people who are actually suffering from noticeable symptoms.
Yeah, well, I mean, before COVID, the definition of a case was someone who had some kind of confirmatory test and symptoms. This is very new for COVID, that you can kind of define someone as a case just based on a test, and that in combination with this kind of mass testing it seems designed to maximize fear by generating ever increasing numbers of cases. I mean, before COVID, if say a child came to the emergency room with respiratory symptoms, which is extremely common, if the child was sick, then we'd probably run some tests, see if they have RS virus or influenza or whatever, and admit them for treatment. But if the child was healthy enough to go home, which they are like 19 times out of 20 at least, we wouldn't do any tests, because that would be considered, at least here in Sweden, it would be considered a waste of taxpayer money, because testing someone who's healthy enough to go home isn't changing anything. Normally in medicine, the only reason to do a test is if it somehow changes management. There's no point testing someone for something if it's not actually going to change anything in how the patient is managed. So, I mean, this is kind of a departure from the normal way of doing things in medicine, and I mean, it's clearly has nothing to do with medicine. This is clearly a political thing.
Oh, absolutely. And I think that the COVID apps that people have been encouraged to have on their smartphones, and they've been getting pinged. I don't know what word you're using for that in Sweden, and then they have to isolate, and they're off work and off school, and there's staff shortages, and medical staff are getting pinged all over the place. And I think at one point they took, certainly with the London police and possibly hospital staff, said, okay, you need to switch your phones off. You need to leave them in your lockers, because we're not going to have anyone left to do the work here. And all of the other, as you say, all the testing regime in itself, the testing regimes are hugely costly in terms of time and resources, not just money, but human resources as well. And and it clearly, as you say, has got nothing to do with science. Very little to do with science, and nothing to do with actually helping people. I'll just briefly turn to a question which, again, I've talked to people about, just, friends, colleagues, and they saying, oh, really, what's all this about? And I remember at school learning that basically viruses weren't alive. There's the question that they don't fulfill all the life processes, which briefly are, I had to go and look this up again, movement, respiration, sensitivity, nutrition, excretion, reproduction, growth. Living organisms display these life processes. Viruses do not. So perhaps in layman's terms, you could just say a word for people who are listening to try and answer the question, or at least give some sort of information on the question, are viruses alive? Because I started to think about this when we all began to slather everything in antibacterial gels and douse everything with bleach. And I just thought, well, what are we doing this for? We're not dealing with a bacterium. We're dealing with a virus.
Yes, well, it's correct. Viruses don't have any metabolism of their own, and therefore, in that sense, they're not alive. A virus is completely dependent on getting inside a host cell and getting the host cell to do the things it wants done. The virus is basically it's an inert particle. It can't do anything on its own. It just by luck, it latches onto a host cell, and the host cell drags it inside, and then uses the virus's DNA or RNA as a blueprint to produce new viruses that it then expels and that can infect other cells. So the virus on its own is completely inert, and I mean, well, bleach is kind of such a powerful substance that it'll destroy viral particles. If you take, say, like an alcohol-based disinfectant, it can be effective against certain types of viruses, depending on whether they have kind of a lipid membrane on the outside their shell, or if they don't. So alcohol-based disinfectants work against certain kinds of viruses and not against others.
But in some cases, take bleach, for example, it's not suitable to apply that to your human hands or any parts of a human body or any surfaces that humans be coming into contact with. There'll be certain cases where it's not appropriate. You're going to cause damage to do that.
Absolutely, and I mean anything biological will be harmed.
Yeah.
So I mean,
some people might say, well, asking whether viruses are alive is a distraction in all of this. But I just think it's an interesting question, and for me, it speaks to like how little general knowledge there is about what's actually going on here. So that's why I brought it up, because I was watching a commercial on TV the other day, or it happened to be on when I was switching the TV on to use the multimedia center, and it had a picture of this bottle. And the brand has been around for a long time, but it's recently been redesigned, and it's got a picture of a very angry-looking little coronavirus character on the front being shown being squashed. This is not bleach. This is spray that's designed for kitchen and bathroom surfaces, and any table that you might eat off, and general surfaces around the house. And you have to be very careful with the strength of what you're applying along the lines that we just mentioned. Now, another interesting thing for me is how many, even in the mainstream media early on in the pandemic, certain facts and figures were put out there that put the thing in a fairly reasonable perspective in terms of how deadly it is or was. And it was openly stated there was a 99 point whatever survival rate, and it showed how that varied a little bit depending on how old you were and if you had any comorbidities and whether you had immune deficiencies and whatnot. And there were other figures like that for a lot of people were kind of like, okay, so that's not so bad. This is clearly a thing, and it's going around the world at a rate of knots. But it doesn't sound like, it's not going to kill that many people. And that flipped very quickly into absolute horror stories. And those facts and figures that you could go back and dig up, they got forgotten. So it's almost now, if you start to talk to someone about survival rates and about how deadly this actually is, suddenly you're a conspiracy theorist. But we could point to news reports, mainstream media news reports from January, February, March 2020, and it's all there. But, the tide of fear has swept so many people's memories clean. That concludes part 1 of our interview. Part 2 will be available soon in the subscribers area. at legalizefreedom.com.
legalizefreedom.com